Welcome to Health System CIO's interview with Dr. Morgan Jeffries, Medical Director for AI with Geisinger. I'm Anthony Guerra, founder and editor in chief. Dr. Jeffries, thanks for joining me today.
Absolutely. Thanks for having me.
All right, so you want to start off by telling me a little bit about your organization and your role?
Sure. So Geisinger is an integrated health system in central and northeastern Pennsylvania. So we have both a clinical enterprise and an insurance arm. And I am the medical director for AI. I've been officially in this role for about a year, a little bit less than that, but have been working in this capacity really since our previous medical director for AI left to take a position with an outside company. And the role, it's a lot of things. We're like a lot of people in AI. We're very busy right now. We've gone from being kind of a small shop with really mostly data scientists and engineers that had, um, had some guidance internally in terms of what were high value programs, but didn't have a lot of, I would say, people within the organization, individuals within the organization reaching out and saying, "Hey, can you, help me with this?" It's the one that's got a lot of demand on us now. So we've been growing the team and been sort of restructuring the team more around product teams with dedicated product managers, still data scientists, still engineers, some designers as well. And so that's been one piece, is kind of like figuring out what that looks like, and then trying to identify those high value programs, which is a lot of work in and of itself, doing that kind of discovery, and then figuring out, okay, well, which of these really do we have the capacity to do that lines up well with our organizational priorities. And then we're doing a lot of work in governance,
Yeah.
which is something that don't know that we had a formal governance process until about a year ago, when our board kind of saw that that it appeared at the time, this was a different White House administration, that we're getting signals about like what regulations might come to pass and what that might look like. And so the board felt that it was important to go ahead and define what our policies were going to be around AI. And so we built that policy last fall, and then tried to do it in a way that was covered our bases, but was loose enough that gave us room to figure out some of the specifics of the governance process, which is good because even now we still have a lot to learn. Things are constantly changing there. Um, so I've been very involved in that, both in actually evaluating programs as they come through, but also in kind of the development, the evolution of that governance process. And then education, which is something that we're really starting to pick up steam on. This is an area that we want to focus on now, is on workforce education. We're getting a lot of requests now, I would say, for some educational materials around some of those more clinician-facing tools, or you know, uh, employee-facing tools that are built on top of generative AI. So people wanting to understand, how do they use LLMs and the tools built on top of them. Uh, and then, a general feeling that we want to have some kind of, uh, we want our workforce to have some kind of general AI literacy. That
Yeah.
one's a little tougher because it's not, that part is not something that we so much want to push on people, and it's not something that necessarily all of our employees are going to demand. I think people who are early career are probably, it's probably more of an imperative for them to get a general understanding of AI. So we're trying to curate some resources there and make those available. And then what the post was about was this sort of uh, dawning realization that um, there was a certain lack of awareness of risks around AI. Not that we had encountered any dangerous situations because of it, but just in talking to people and in evaluating programs as they came through governance, realizing that people really didn't recognize, what the risks were, both in general and about their own programs, or why we were pushing so hard to help them help us figure out what those risks were and how we were going to monitor for them. So that's I'd say that pretty much covers basically what I've been doing in the space in the recent past.
So that's a lot there and definitely fascinating. Um, so let's go back and dig into some of this stuff. So the dynamic that you're describing is, you know, you have a unit of sort of AI folks like yourself, led by yourself. And I think you mentioned the dynamic of of requests coming into that unit from users and clinicians and people requesting things. Tell me more about and it sounds like through these requests you started to discern points of risk. So and I want to talk more about the whole governance thing here because this is all fascinating. So request, you know, any kind, you have a unit of people that are doing work, right? You are one of those particular units, this AI unit. Anytime you have a unit of people doing work, you have requests coming in, you have more requests usually than can be executed on. Therefore, we need to decide what to execute on. We call that governance. That's a process of deciding what we're going to address with the limited resources. So that's one dynamic. And also, it sounds like in these requests, as you're starting to work on some of these, you're discerning risk. You're trying to counsel the folks requesting these projects about risk. And you start to say to yourself, I think we need to take a step back here and have a larger approach to addressing some of this risk in a larger way rather than just one off for each project request. But take me through any of that where you want to jump in.
Sure. Yeah, I should probably. There's some points I want to clarify. So I should say, I am not leading the AI group, or certainly not leading the whole AI effort at Geisinger. But I am part of the leadership of the team that is really central to our AI efforts. I work with our AVP for AI and our senior product manager or senior director for AI product management and they're both part of that core leadership group. But we also have other people working. Have to work with people in a lot of other teams. So like data management. We have product teams in what's called our digital transformation office. We have our IT. A lot of different, and I'm not naming close to everybody involved, but there are a lot of different people in the organization who are heavily involved in these efforts. Um, to clarify, when our group interacts with AI or has activities in AI in kind of three ways. One is just building things. That one's pretty straightforward, and that's really that used to be what we did almost exclusively. So somebody has an idea for an AI system or a problem, that they think AI might be able to solve, and if we agree, actually we could actually go and train the model, validate it. Set up incorporate it into existing workflows in such a way that it accomplishes whatever task it's trying to accomplish. But it's actually building that system end to end and maintaining it over time, and that's one of our core activities. There's also a piece though that is not quite as involved in that, which is a form of, we'll call it AI enablement. So somebody in the organization might be trying to work with a vendor who offers a solution in the AI space, and they might need us to, for example, vet that solution in some way, talk to the vendor, try to get more information about, basically get what would be on like a model card if they haven't directly provided that. Ask the right questions about, okay, so how are we going to validate these data or validate this model locally on our own data? How will we be able to monitor over time? And sometimes, helping to figure out how that's going to be incorporated into systems, at our organization. Um, and a piece of that is something that we kind of caused ourselves, which is we also have to help them figure out how they're going to adhere to our policy requirements. So the third big piece is governance, and that is basically making sure that programs do follow those policy requirements. And so roughly what that looks like is any program, whether it's something that we're building or whether it's something that's coming from a third party vendor that has any kind of significant AI component to it, uh, gets flagged, and that comes through our intake process for governance. Right now, what we're doing is, we're bringing these programs in front of a committee, and that committee is basically uh, trying to make a decision about whether that poses a significant risk, non-zero, not super low risk, but actually significant risk of harm to patients, members, employees, or learners in the organization, or whether it's low risk. And if it's low risk, then we basically say, here's some best practices we think that you should follow when implementing this. We're available to help in the way that we normally are with enablement, but you don't have specific requirements from a governance standpoint. There's no artifacts that you need to produce for this. Now, if we think that there's a significant risk associated with this program, then the program owner, so that basically the business owner for the program that's coming through, whoever is like saying like, yes, this is a thing that we are rolling out. We want this. Um, has to take ultimate responsibility for doing really four things. They need to do an assessment of the risks associated with the AI system, which is something that you can kind of sort of get from the vendor, but it also may be specific to the way that it's being implemented. So like you have to bear that in mind. And then an
Hmm.
equity assessment. So the first one's kind of how could this harm people? The second one is how could this harm specific groups? And then a monitoring plan. How are we going to make sure that those things don't happen on an ongoing basis? And then an escalation plan. If we find that there's a problem, what are we going to do? Uh, and this is an area so we go into this fully expecting that we're going to have to provide assistance with that. I mean, I would say if you've not done an equity assessment before, any of them really, but an equity assessment in particular, like it's sometimes really hard to think about like, yeah, how could a specific group be harmed by this? It can be challenging to go through that exercise, and if you haven't done it, and especially if you don't understand it, especially if your default assumption is, well, I don't think it could, it
Hmm.
can be hard to get them to get really engaged in that process when they're trying to get so many other things done. Um, so there is a separate piece, and you kind of mentioned this before. I want to call this out. That's so governance is not this, but there is a prioritization piece for
Yeah.
the first two parts. Like if we're doing either building the system ourselves or just enabling, a vendor built solution, um, then that's a piece where we have to do prioritization. But we wouldn't put that under governance really. That's really just we're trying to figure out where we can put our resources. Governance is for any program that's going to come through is gonna have to be flagged and evaluated by governance.
Yeah, I think maybe there's different ways to think of the term governance. You used it in a way that to make sure it's adhering with your policies and things like that. What I was thinking of was, you're getting a million requests, look at this, look at that, can you work on this, can you do that? And you say, well, internally, you're as a group, you're saying, we can't do all of this. So how are
Mm,
we going to prioritize and pick the projects that we're going to help and work on that we think line up with the strategic objectives of the organization, and get the biggest bang for buck, so to speak. And with the rest of the folks that you can't help currently, or maybe you're not going to help at all because it doesn't meet certain requirements, you want a lot of communication and transparency, so they don't feel they're being ignored, but they're told, listen, what you've asked us for doesn't meet criteria, or we can't work on it maybe 3 months now. We could take a look at it. There's got to be again, when you have more requests than you have ability to service, we have to have some mechanism for deciding what we're going to work on. That's the high level idea. When I say governance, that's what I mean. Do you do something like that? You have to do something like that in order to serve the organization.
I mean, we absolutely have to do that. We generally, whenever we talk internally about governance, we're talking about that risk piece.
Yeah.
How do we reduce the risks associated with this? But yes, the prioritization is extremely important. That's kind of an evolving framework. But what we're trying to do. a big part of what we're trying to do is align those choices for where we're going to focus our efforts around mutually agreed upon priorities that we've arrived at through discussions with our executive leadership.
Right.
So we've now kind of sketched out with them, here are some challenges that the organization is facing that we think AI could help
Right.
to address. And so, as much as possible, we want to stay focused in those areas. So as things are coming through, like bearing that in mind, and saying like, okay, well, this aligns nicely with this identified priority. So I think it makes sense for us to pursue that. Whereas this other thing doesn't doesn't sound unimportant, and it maybe, it doesn't, it's not to say that everything has to perfectly align with that to, to go through, but it definitely is a mark against if we can't somehow align it with those. It's going to some extent, go a little bit behind uh, programs that do align with those priorities in the queue.
Yeah, okay, let's talk more about this concept of uh, things being flagged that I guess have AI. And at a fundamental level, AI is a difference maker in terms of risk, right? And I know there's different levels of risk, but there's non-AI technologies and probably less and less of those non-AI applications because every application is being infused with AI, right?
Hmm.
So it's being infused with AI, and once it is infused with AI, it requires a different level. It's almost like you picture things moving in an assembly line down a conveyor belt, and once the computer senses there's AI in the package going down the conveyor belt, it's got to go to the left. It's got to go to the left because it's got to receive different treatment and analysis, and then there may be further bifurcation based on risk. So high risk, it goes down a different chute and all these kind of things. So let's talk a little bit about that concept. And also, do you think, do you think that it's possible AI is slipping into organizations unknown in upgrades. So existing vendor, they just put a an upgrade software upgrade and they didn't let us know, but they slipped some AI in because they're trying to make their software fantastic and better than ever. But nobody made a big deal out of it. Nobody told us, and now we've got AI that wasn't vetted the way we want to vet our AI. So what are your thoughts around
Yeah,
that?
yeah, yeah. Okay, yeah. I mean, you're hitting in you're hitting in a lot of different ways on what I think is a really key point. So we've been in kind of our like .com era of AI,
Yeah,
where everything is like just declaring like we're whatever .ai.
right,
Please listen to me. We have AI. AI, AI, AI. So they really, want to keep hammering that point. Much like in the .com era, everything was whatever .com, and merely having like some kind of internet connectivity, or having like a web presence, it was like, oh wow, this must be valuable, and people got super carried away with it.
right.
Um, but obviously there was a crash after that. But at the same time, the internet for sure did not go away. We are having this conversation over the internet right now. I mean, internet has transformed every aspect of our lives in ways that are seem largely invisible. Like it's just not something that we spend a lot of time thinking about unless the internet is out, which
Oh
rarely
yeah,
happens because the demand is so high.
right,
It's got to have extremely high uptime. Um, so right now, yeah, AI, people are like declaring that they have AI, but you've already, as you pointed out, I mean, we're already starting to move into an era where that's going to be less and less talked about, and products that aren't, where AI isn't the centerpiece, are going to start introducing AI features as it makes sense, like
hmm,
features that add value, but that are only possible because of AI.
right,
So it's AI in the product. Yeah. So right now, like our the way things are set up, so we see all this coming, and we're trying to figure out how to negotiate it. Right now, um, we're set up to catch when a new vendor comes through, because there's
right,
a submission through our IT PMO office, and our contracting office also knows to flag those things. So there are questions on the intake forms for those that ask about AI. But even if the person doesn't flag it, the people in those offices, they're looking for AI, and if they see it, they're going to flag it so that it comes to our attention and comes through our process. But yeah, what about the vendors where we already have a contract and they're just rolling out a new feature? Exactly. There's also all these issues. So we what we have noticed, what we started to realize was we were going to have a big volume problem. This is before we even got into this. We started noticing we were going to have a big volume problem. So we had already we were getting like a lot of requests for evaluate, this solution built by this new vendor, and we had this backlog of programs that we need to evaluate, that we're trying to get through our governance. But we started to recognize like, oh, several of our existing vendors are already rolling out these agentic platforms on top of whatever they've built, so that now the way that we define AI systems, I mean, every one of those agentic solutions would be a distinct AI system that would otherwise need to go through our governance. So we've
Hmm.
already started to move towards having those identified platforms have their own governance process, that we sort of collaborate with them, and they come to our governance meetings. But so we sort of guide them through it. But like the platform owners themselves are responsible for making sure that any kind of solutions that are built on top of them adhere to our policy. But there's this other thing of, yeah, like as features start to roll out in existing software, where you don't even really you wouldn't really consider it a platform, but like there's AI now in it. How is that supposed to work? I think this is part of where the education piece is going to become important, because it's the centralized governance, that model is going to fall apart.
Yeah,
I don't think
right,
that's sustainable in the long term.
right.
I think that we will need to be available to sort of oversee things, and we may need. I mean, we definitely have some people that are on that committee where I really respect their opinion. They're very thought. Like we have two bioethicists on the committee, and we have several people with technical positions in AI. We have some clinicians, but I- you know. They're not going to be looking at every single program. It's going to be, or every single system. It's way, way, way too many. Um, so we're going to need them to help us figure out, okay, how can we make the machinery of governance work? um, what is this going to look like? And then also there's probably going to be some specific cases that come up where it's like, you know what, I actually do want to get your expert opinion on this. Like
Hmm.
I do want I largely want you working on a system level, but there are going to be specific things where we're going to say, no, 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 I want you to look at this program specifically and help us think through, like, how do we keep people safe? Like, how do we monitor this? What are how do we figure out what the risks are? Or, how do we do an adequate equity assessment with this? So we're going to need them. It's not going to be every single program, but probably will be some select programs. But I think part of it, I mean, does everybody become a platform owner? Like anybody who's responsible for an application, do we just call that a platform and say, look, these are your responsibilities moving forward? It might look something like that, but I think this education piece then becomes key, because like most of them don't know what to look for at this point. And so that's something that we need to teach them about.
Yeah, there's a lot there, but I just had a funny thought as you were talking. I'm trying to train myself to say whenever I've got something I need to do or something that I usually do that is time consuming or a little difficult, whatever, can AI help me with this? Like, you have to train yourself to say, can AI help me with this? Otherwise, you could be missing opportunities to become more efficient. And as you were talking, I wrote down, is there any reason to think that AI couldn't assist us in evaluating the risks of AI? So as you're sitting there trying to evaluate the risks of all these software, all this AI coming into your organization, it makes perfect sense that somehow you would leverage AI to help you discern where the risk is and address it. So it gets kind of crazy. you you got, we talk about chatbots doing battle, bots, a bot from a health system doing battle with a bot from an insurance company trying to decide if a claim's gonna get paid. And the humans sit back and watch the battle. I don't know. It gets any reason to think AI can't help us figure out the risks of AI?
Um, yeah, this is complex. So there are. So I mean, I have the same concerns that many people have around automation bias, automation complacency, and de-skilling, where it's like you don't necessarily want to become over reliant on this external tool to help you work through thorny ethical questions. But at the same time, um, there are people that are in these roles where they would bear some responsibility for this and in trying to do these types of assessments, that is figuring out what is the risk of this AI system, how could it harm a specific group, how do we monitor, where they don't have any of those skills right now. And
Mhm.
so supplying them with a tool that can assist them in that might be better than the alternative. We don't have anything like that right now, so this is a purely a hypothetical.
Yeah.
And also, I mean, we are so over capacity in terms of like servicing requests that are coming through that I would love to be able to peel off and have us work on something like that. But uh, we might be trying to look for a vendor to help us solve that. But yes, I do think that's a possibility. Um, I definitely think even for people that are good at that kind of thing, the AI could be helpful, maybe in kind of surfacing some things. But it's definitely for the best. You really want them to remain. I mean, our bioethicists, I don't think are probably going to fall into the trap, but I would not want them to. Like it would
Uh-huh.
be terrible if if these people were looking at these programs coming through and just saying like just whatever the AI said is fine. I don't think there's any risk of them doing that, but that's exactly the kind of person I wouldn't want doing that. Whereas somebody
Yeah.
who's from the project management office who's like just they have like a million things on their checklist and this is one of them. Yeah, I mean, it might be a net benefit. I don't think that they're going to be de-skilled in that regard. In fact, if they look at the suggestions, they actually might be gradually upskilled as
Right.
they realize, like, oh yeah, I wouldn't have thought of that. So
Yeah, one of the metrics people are looking at, is how often, let's say a clinician is using ambient AI, ambient listening to help them with their notes and things like that, and they're supposed to review the note, and edit it if necessary. So one of the metrics people are looking at is how often does a particular clinician make any edits to their notes, and if that number is close to 0, they wanna intervene and have a little discussion and say, "Maybe maybe you wanna take a closer look at this stuff because we don't think it's absolutely perfect every single time." So, you can't check out, right? This is supposed to be an aid, but that human in the loop idea means you gotta give it a look.
yes, but when it does things really well on a very consistent basis, the longer you go without encountering an error, the harder it is for you to focus your attention on looking for those types of errors.
Right, right.
I'll say that I've worked with ambient listening, and yeah, the notes are really more structured for ambulatory. So in my role, which is neurohospital seeing stroke patients, what it generates is far from error free. It's usually not in the
Uh-huh,
style that I want. Uh,
uh-huh.
it's not full of errors. It's just, oh yeah, this isn't telling a good linear story the way I wanted to.
Right.
So I still have to do a lot of editing. I think for colleagues who are like, in primary care and it's really capturing a lot of stuff. And it's not, again, I mean, they're not, it's not erroneous. It's just, yeah, for me, it's not a good, clear, linear story. But if you're seeing somebody for a once an annual checkup and they told you about 5 different things and it just gets all of those out, you may
Yeah.
look and say, like, yeah, I mean, that looks great. This is perfect as is. And if that happens enough, you know, it's harder for you to stay focused and notice the times when it's like, "Oh, I actually missed something, or that's not quite right."
Are we at the point for someone like yourself where, it can get to know you and you can teach it how you want your notes to sound and say, "Hey, here's 3 examples of my notes, AI. I want you to do my notes in this style." Or are we not there yet with the tool you're using or any tools?
Okay, this is super wonky. But yeah, so machine learning typically, so humans learn constantly, like we're learning all the time.
Right,
And that learning mechanism largely looks the same as it did like when we were kids in terms of like what the way that learning is instantiated is like it actually changes connections in your brain.
right.
So um, for in contrast, machine learning models are split. They have a training mode where they're actually learning things. Those weights are getting updated. And then they have what's called inference mode, which is when they're in production. So anything that you're using as a product is in inference mode. It's not learning unless it gets explicitly retrained, which
Okay,
does happen. So like OpenAI, Anthropic, I mean, they're constantly updating their models, or at least they do release updates to their models. So they do go through retraining. That's explicit retraining. So how do these models then, how could they learn like a style? So as you mentioned, you could give them examples and you could give them examples and those examples could be sort of saved and then included as part of the context at some point. So like when an LLM is having a conversation with you, it actually doesn't even remember any of the previous steps in your conversation. It's just seeing the entire transcript of the conversation every time it responds.
okay,
That's how
okay.
that's how it remembers what happened earlier in the
Right, right, right,
conversation. So you
right.
can also put extra stuff in there, and you could, for example, put in notes and have it say like the what like you don't really see the conversation with them, but like the prompt for them could be like the entire you're supposed to produce, a note from a patient, from a or transcript of a conversation between a doctor and a patient. Here are some example notes that were generated by this person. They please adhere to this style, and here's the
Mhm,
transcript of the conversation. So you could
mhm,
do it like that, and
mhm,
yes, that could influence the style that it outputs, so it's closer to yours. There are some other things like there are certain like kind of what are called lightweight fine tuning methods that are sometimes used. Sometimes, like some of the foundation model companies will let you like create fine tuned models, usually for like enterprise. And so you can do it that where it's not like a full retraining of the model. It's kind of like you do. I don't want to get too technical. You do a little bit less tuning. Um,
mhm.
our vendor doesn't offer that. I have heard that some ambient listening vendors do allow you to, to get at the to sort of emulate the style of the person who's authored them. I don't know which of those mechanisms they go with, whether they just shove some examples in the prompt or whether they do any kind of like lightweight fine tuning. But
Mhm.
it does apparently exist. Since I haven't tried it, it's hard for me to comment on like, is it good? Because, of course they would say, look, we found this one guy who says it's great, so like it's good. But like the proof is in the I mean, when you actually go and kick the tires, sometimes you're like, no, this is not good. So I don't know the real answer, like if it can really competently do that. But mechanistically, there are some ways.
Well, like these kind of tangents in these type of conversations are fun because this stuff is a lot of fun and it's fascinating and all that kind of thing. But let's talk a little bit more about your thoughts on workforce education. I talk to a lot of people about that. One of the big picture ideas is or the big picture concepts that people are working on in health systems is we want to create guardrails. We want to create all the governance around AI. We want to roll out tools with the proper guardrails. So, whatever we consider risk mitigation, hallucination, bias, whatever issues, and you touched on this in your post that you did on LinkedIn that I'm referencing, that the reason I reached out to you, we want to put AI into our employees' hands in a safe way. We want to educate them on the possibilities of what can be done with it. And then we want them to go solve problems, go solve their problems. We don't know at a high level, executives, we don't know every little problem they're dealing with, but we want to empower our workforce to solve problems and become more efficient. Am I right that that's kind of a really big picture thing of what health systems are trying to do? Because there's so many issues in health systems that needs solving. So this is one way we're going to try and really help move our organizations along. We just got to figure out how to do it right.
I would say that would be the smart way to do it. I don't know if all health systems are doing that. Ethan Mollick he's done a lot of good stuff, but I remember he had an essay from like or blog post from like maybe a year and a half ago where he talked about this approach that a lot of organizations were taking of with AI of kind of trying to censor it or well ignore it, censor it,
Yeah.
and then centralize it as option three. Uh, and then uh, like you pointed out, centralization, well, you didn't say this directly, but what you were kind of getting at, centralization, which is kind of the most mature stage of that, is actually probably not a great approach because no one knows all of the use cases. And nobody at the highest level really knows everything that their employees are doing on a day-to-day basis. The people that are on the ground know what they're doing. I mean, and the executives know what they're doing. They know their jobs better than anybody else, but they don't know their employees' jobs better than their employees do. So
Yeah.
for them to dictate like, oh, here's exactly how you like, this is
Right.
the way that you should solve this is arguably not the best approach. I mean, I think there are certain high yield things. Ambient listening is a good example of like, look, you can take a centralized solution, and we kind of have to do that partly, because of the contracting and the risk involved. Like, we kind of have to pick a solution there and offer that to people, but it's very beneficial. So that's great. But there are a lot of things with these AI assistants where really a much better approach is to create the kind of culture where people are working with those things and have uh, and feel like I would say comfortable uh, talking about that publicly, with their colleagues. They can say like, "Yeah, I used this to solve this problem in this way," and they can kind of share that knowledge. I think that addresses not just like a competency issue, but I think you kind of also help to solve some of the risk problems that way. I mean, think about like phishing emails 20 years ago versus now. Um, like I have gotten phishing emails. This is so embarrassing, I should say, that I have clicked on from like through my work email that were like deliberately planted, partly because partly because I get outside emails that sound just like those things. They're like, well, this is a good example of phishing, and like there are subtle clues there that I could like look at and be like, okay, yeah, this maybe doesn't match up with like the domain, like this link doesn't match up with the domain that this is coming from. But we actually do because we do telehealth and we get like contracting stuff or like onboarding stuff from like all these outside organizations. So we'll get emails and with no heads up about like you have to complete this paperwork in this system, and it's just like, okay, I guess I'll go and do that. So it looks kind of realistic in that regard. But I mean, I've also like I got one probably about a year and a half, 2 years ago, like that looked exactly like an email from Coinbase saying I needed to reset my password.
Oh
Uh,
no.
yeah, yeah, like it looked very real. But I mean, but so like there's a level of sophistication there, but like compare that to like the Nigerian prince, which is just it's laughable. Exactly. Because everyone knows you don't send money to the Nigerian prince.
No.
Everyone knows that
Yeah.
because we talk about it. It's a joke. And
Yeah.
so like there's had to been there has to these phishing emails have had to get a lot more sophisticated
Yeah.
because of that. So when you're talking about the risks associated with AI, if everybody just understands like, yeah, it hallucinates. I mean, you have to like this is a risky domain that you're working in. Like you took that directly and this output directly and put it in this report without checking. That's
Right.
insane. Like,
Right.
why would you do that? Uh,
Right.
that's kind of what we want to get to is that idea of like, yeah, literally everyone around you knows that was stupid. Uh,
Right. So I mean, I guess we have to assume there are people in the workforce who don't know that it hallucinates. Maybe they haven't dipped their toe in, but they're few and far between, and they're becoming fewer every day. But you still could have some that don't understand that it does these things. So when you have to address that, right, with some basic education, I guess.
Yeah. Yeah, I mean, there are some other things that like people might be less aware of, like the sort of the way that confirmation bias and sycophancy can kind of work off of each other. So as opposed to like regular web search where you have an argument with somebody and you go to www.provemeright.com and you find the evidence that supports your point of view and you say, you see, in this case, it actually just like it just serves up an answer that basically caters to the question you ask. So if you frame it as, I mean, I gave some. I'm doing like a video right now, and I gave some examples of one. One was like, I love coffee. I think it's great. Tell me about all the. My friend says it's terrible. Tell me about all the health benefits of coffee, and it gives you all these health
Right.
benefits. And
Right.
then do and then say, in a new chat, I hate coffee, and I've heard like there are a lot of health risks. Can you? And my friend says it's actually healthy. Can you show me what the health risks are? Because I'm pretty sure he's wrong. And it just spits out all of
Right.
these, reported health risks. Which, by the way, I mean, there's nothing for the most part. Coffee is like within reason is fine, but uh, like everything everything that I looked at with that it generated was factually accurate, but it's tailoring its answer so that you hear what you want. And if you're not aware of that tendency,
Yeah.
then you're going to be like, I knew it. I was right.
Well, and the biggest thing to me is, and I think it's starting to do this now. The biggest thing to me is it used to not say, I don't know. It would never say, I don't know. It would give you some kind of answer always. If you don't know that, you could be in big trouble. You have to understand this is not going to tell you, I don't know. If it doesn't know, it's going to make something up. So you got to be careful, right? That's a
Yeah.
big one.
Yeah. Yeah. So I think getting back to your point, I think, hallucinations, that's a term that it's kind of found its way into the culture that I think a lot more people are familiar with. And so they have a general idea, even if they don't use these tools, they've there's a good chance that they've heard that term. But I think there's a lot of those subtleties of human AI interaction that people don't really appreciate yet, and that's an area where we can make some strides. And so I'm hoping that our directed education efforts, plus just that sort of cultural diffusion of knowledge, will help sort of get the word out, and we'll reach a point where people are interacting with these things in a way that is much less risky.
All right, let me just ask you a final question. I'm gonna let you go, Dr. Jeffries. This has been a blast, and I feel like going to watch The Terminator because that was a good movie. That was a really good movie, by the way. Very good science fiction in that movie.
I'm aware.
Um, your best piece of advice for someone in your position at a comparably sized health system. So you somewhere else with 5 less years or 3 less years experience. What's your advice to that person trying to really, execute their job to the best of their ability?
Yeah. Um, I would focus, I really actually would focus on that cultural and education piece, trying to encourage people to use these tools and learn about them.
Mhm.
Because those things, a lot of the tools are available for free from the health system's perspective. And if people and if you, especially if you if you have a dedicated tool that's available, like an AI assistant that's available that people can use PHI and business sensitive information with. So it's like for those things, you use this, but for other stuff, you can use these and really encourage that use. That will move your workforce along
Yeah,
and help you. I think that a workforce with a good level of literacy in this area and good competence around this is going to help you to discover those higher value use cases. I would say I would move cautiously into really scaling up a lot of organization sponsored programs, like, oh, we got to roll out all these features and this and this and this. Go slow because honestly, a lot of the stuff doesn't have proven value around it. I
Hmm.
mean, if there's demand coming from your users that, take that seriously, I'd say ambient listening is one where there's a lot of demand, and that's probably going to become sort of table stakes.
Yeah,
That
I agree.
if you want to have happy employees or happy frontline providers, you're going to probably need to have a solution like that in place. But don't feel like you have to rush into everything
Hmm.
to be a leader in this space. Let other people make mistakes for you, and also that lets you that gives you a little bit more room to figure out your internal processes. So I think the I would say that the biggest problem there is that. Um, it can be tough to get people to tap the brakes. So, um, that's what I would advise if people are listening to you. If not, then just I still would definitely emphasize the cultural piece, the education piece. But I would say, apart from that, figure out how you're going to scale your efforts to keep up with all the demand
Hmm.
as soon as you can, because it becomes overwhelming pretty quickly.
Dr. Jeffries, that was perfect. That was wonderful. That was a lot of fun. I want to thank you so much for your time today, and I hope we can catch up again down the road.
Yeah, absolutely. My pleasure.
Have a great day.
Thanks. You too.